Welcome you all to Sri Chhatrapati Academy's Study Ayush Forum by the student for the student. So today we will start our new topic. So as we have completed our scapula bone and humerus bone, so I decided today that we will start its joint, that is the shoulder joint, right? Now before starting, what is meant by a joint? What is meant by a joint? Wherever two or more bones or two or more cartilages articulates or joints is called as a joint. Why there is a necessary or why there is a need of a joint? So joint is needed for the movements, especially the synovial joint is needed for the movements. There are many other joints which do not move. They are immovable joints which are present in our skull. But the particular function given to the joints is for the stability, for the posture and the structure maintenance and the movement, right? So we have seen what is joint. So on the basis of the movement, joints are classified into three types. First one is immovable joint, that they do not move at all, that are present in skull, temporal joint, parietal temporal joint. The sutures are present that are called as joints, which are also called as fibrous joints. Next is the type which is known as movable joints or synovial joint. These joints are movable type. The third one is partially movable joints which are present in our vertebral column, which makes the partial movement, not all the complete movements, but makes the partial movement, are called as cartilaginous joints. Right? Now, today as we are talking about the shoulder joint, the shoulder joint is especially the synovial type of joint. It is a synovial type of a joint. Now, why synovial? Because wherever there is a creation of a joint, there is a presence of a cavity, and in that cavity, there is a presence of an synovial fluid. So, why this fluid is present and why it's needed of that fluid? Now, whenever we see there is a whenever there we see that there is a movement between the two structure, there is a friction force between them, right? And as we apply the physics of 11th standard, friction, that is friction formula is equals to mu into normal reaction, where this mu is a coefficient of a friction substance, coefficient of a frictional substance is present. Okay, now this mu depends upon the substance. It is a substance property, right? Wherever there is a two surfaces, now let us consider there is a joint. So this is a head of the humerus and it is a glenoid cavity, right? When we zoom it out in a microscope, as the bone is present, there will be like this structure over here, and here there will be the like this structure when we zoom it out. And whenever there is this structure and whenever there is a movement, this structure rub each other, and if they rub each other, there is a chances of damage of the bone. And when this synovial fluid act as a lubricant between them, which reduces this friction, coefficient of this friction, and make the surface smooth, and hence this synovial fluid is present in that synovial cavity. Subtype of this joint is ball and socket joint. In this, the head of the humerus is its ball, and the glenoid cavity or the glenoid labrum which is present, it is socket which holds. It's like this. Okay. Next, now articulating surfaces. The main two articulating surface is the head of humerus and the glenoid cavity of a scapula, right? These are the two main articulating surfaces. Now this joint is a weak joint. Why so? It is a weak joint. The reason is its size. Whenever we see, this is a head of the humerus and this is a glenoid cavity, and here is the presence of outer cover is glenoid labrum over here. So the size of the head of the humerus, size of head of humerus is equals to 4 times the size of the glenoid cavity. So hence this joint is a weak joint. Now consider, whenever you need to hold tightly something, you need to cover it fully, so only you can encourage it, but it's not fully covered, it's like this covered, partially covered, so it will be weakened. But this is an adaptation to make the maximum movement. We will see the many movements in our shoulder joint due to the reason of this, because it is weak joint and it permits the more movement for due to this reason, because size of the head of the humerus is 4 times the size of the glenoid cavity. This glenoid cavity is also shallow, it's not a deep, it's only shallow. So hence there is less stability and it permits the greater movement as compared to other joints. Now you will say that as it is a weak joint, we say, then how it is stabilized, how it can hold. So there are basically 5 reasons due to which the shoulder joint is stable. First one is the arc of coracoacromial ligament. The ligament which joins the coracoid process of scapula and the acromion process of scapula, which makes the arc, and that arc it looks like the seat for this joint, and hence this joint is stable. The second one is the rotator cuff muscles. Now rotator cuff muscles are called as musculotendinous muscles. What is the meaning of this is the tendons of some muscles, which the muscles are sits muscles, SITS. It is a short form, you can learn it very nicely. S stands for supraspinatus, I stands for infraspinatus, T stands for teres minor, and S stands for subscapularis, in which the subscapularis is anteriorly, supraspinatus is above, teres minor and your infraspinatus is from posterior side. So all these muscles tendons come over the head of the humerus and they make the arc like this, and due to this there is a stability of the shoulder joint. The main reason for the stability of the shoulder joint is the rotator cuff muscles. You will keep in mind SITS, supraspinatus, infraspinatus, teres minor and subscapularis muscle. Now the third one is the glenoid labrum. There is a glenoid cavity and there is a glenoid labrum. It's nothing but a fibrocartilaginous tissue which makes the glenoid cavity little more deep. So it can hold the head of the humerus tightly. Okay. Now the fourth one, due to stability provided by the muscles, muscle which joins the humerus to the pectoral girdle. Now here the term comes the pectoral girdle. What is meant by girdle? Anything which joins the appendicular skeleton with the axial skeleton, means the hands, the main trunk joined to the hand, is called as girdle. So humerus do not comes under the girdle, only scapula, clavicle, all under the things come under the girdle. So this muscle, which are the two both muscles, this is the bicep muscles and posteriorly there is a tricep muscle. These two brachii connects the girdle, connects the humerus to the pectoral girdle. So this connection also stabilizes your shoulder joint. Fifth one is your atmospheric pressure. Now we have seen that there is a synovial cavity present over there. Wherever there is a synovial cavity, there will be a atmospheric pressure between them, from all the sides equal pressure, and that pressure is needed for the stability of the joint. right? Okay. Now we will see about the four ligaments of the shoulder joint. First one is the capsular ligament. Capsular ligament, the name capsular, everywhere you will come when you learn the joints or the ligaments of the joints. The coracohumeral ligament, the transverse humeral ligament, and the glenoid labrum. Now, the capsular ligament. This capsular ligament is attached medially to the below the supraglenoid tubercle. It is attached on the medially to the scapula, and laterally it is attached to the anatomical neck of the humerus. Okay, and anteriorly it is reinforced anteriorly by the three bands which are called as glenohumeral ligaments, which are superior, medial, and inferior glenohumeral ligamental bands, which give it the additional stability. Okay, and the inferiorly it is marked towards the surgical neck. Inferiorly it is attached to the surgical neck, and superiorly it gives some space for your bicep brachii muscle. Okay. Second one is your coracohumeral ligament, which attaches to coracoid process of your scapula, root of the coracoid process of scapula towards the neck of the humerus opposite to the greater tubercle. So that ligament is present over there for the stability. Transverse humeral ligament is present within the bicipital groove. We have seen the humerus. There is a bicipital groove between the two tubercles present over there, from where the bicep brachii goes. See here, you can see here. Okay. And the glenoid labrum we have seen here. This is the glenoid cavity, and over here is a fibrocartilaginous tissue, which is also a kind of a ligament which helps in the stability of a joint. One more thing I have to tell you, that this is capsular ligament, its extension comes, and its extension is covered by a synovial membrane, and that membrane act as a sheet for the tendons of a bicep muscle, because this bicipital groove, one of the most important muscle of the brachium, the bicep muscle goes, its tendon goes, so it gives that protective covering sheet over this bicep muscle. Now the bursa of the shoulder joint. What is meant of bursa? This is a chair. This chair act as a cushion whenever I sit on it. I sit on it like this. So the bursa is also nothing but the cushion or the packets of a synovial joint present. So it is a packet of a synovial joint which act as a cushion whenever there is a movement between that joint. So there are mainly three, which are subacromial, subscapularis, and infraspinatus bursa. One of the major thing that these are the two types, subacromial and subdeltoid, but that together they are not differentiable, so that together comes under the subacromial bursa, which separates the supraspinatus muscle from your coracohumeral ligament and acromion process. It separates. Whenever you see the sagittal section which is present in your textbook, you can clearly see that this bursa separates the acromion process and the coracohumeral ligament, coracoacromial ligament from supraspinatus muscle. See over here. This is a subscapular bursa and this is a subacromial bursa. Here over the back side there is a presence of a supraspinatus muscle. Now the blood supply of the shoulder joint. How the blood supply is given? They are given by the branches of a axillary artery. anterior circumflex, posterior circumflex, subscapular and suprascapular. Whenever we see the blood supply, remember, start from the heart. Okay. Whenever you start from the heart, there is a heart present. After heart, heart gives aorta, ascending aorta, arc of aorta, descending aorta. This arc of aorta gives three branches: left subclavian, brachiocephalic. Okay. Now this left subclavian artery further give branch called as axillary artery, and this axillary artery further give many branches. Then there is a brachial artery. So this axillary artery gives six branches, major six branches. There are three parts of this axillary artery. We will learn it further when we see the detail about axillary artery. This axillary artery gives three branches, one from first branch, one from first part, two from second part, and three from third part. So all these three are present, which is called as anterior circumflex, posterior circumflex, and subscapular are the branches of third part of the axillary artery. And this is a suprascapular, which is also the branch of that artery. Now, when we see about the nerve supply of the shoulder joint, come under axillary nerve, musculocutaneous nerve, and suprascapular nerve. All are the branches of a brachial plexus. Brachial plexus is nothing but the network of the nerves which supply to the brachium. Brachium is called as arm. Okay. So whatever all the nerves which are supplied to the arm comes under the brachial plexus. So what are that we will learn when we study about brachial plexus. But this musculocutaneous nerve is a part of the lateral cord, is a part of the posterior cord, and this is the part of directly origin from the trunk, upper trunk. Remember it. When we will learn about the brachial plexus, we will learn about it in detail. Now, relationship of shoulder joint. Superiorly, shoulder joint contains coracoacromial arc, subacromial bursa, supraspinatus muscle, and deltoid muscle. Inferiorly, it contains long head of tricep muscle, axillary nerve, and posterior circumflex artery. Anteriorly, it presents subscapularis muscle, coracobrachialis muscle, short head of bicep muscle, and deltoid muscle. Posteriorly, it contains infraspinatus muscle, teres minor muscle, and deltoid muscle. And within that shoulder joint, there is a presence of a tendon of long head of bicep muscle. Now, movements. It is the most flexible joint in our body. Can show concurrent movement, means it can show variable movements at the same time. We can do circumduction, abduction, adduction, external rotation, internal rotation, anything at the same time with the help of a shoulder joint. Due to the large number of movement, it is prone to dislocation. Whenever there is a large movement and also it is a loose joint, weak joint, so this joint is more prone to dislocation, and there comes our doctor's duty to stabilize that joint. Okay. So it is very necessary to study this shoulder joint. Now this is a table which I have brought from the textbook. Now see the muscle bringing about the movements of that shoulder joint. Flexion. Flexion means making it closer. Okay, making your arm closer is called as flexion. So main muscles are clavicular head of pectoralis major, anterior fibers of deltoid, and these are the accessory muscles. Extension means making angle, increasing the angle of the arm. Adduction means adding the arm towards your body. Abduction means moving your hand away from your body. Medial rotation, bringing your hand towards your body. Lateral rotation, bringing your hand away from the body. So these are the muscles, very easy to know. If you learn it, very nice. If you not learn it, just read it, whatever muscles are needed. Now last part of our today's session is the clinical anatomy. We have discussed this point. As it is a weak joint, dislocation is very prone to dislocation. Now optimum altitude. In order to avoid ankylosis, it is a disease. Many diseases of shoulder joint are treated in optimum position, in which the arm is abducted 45 to 90 degree. Here it is a base, and from here it is abducted to 45 to 90 degree. It is called as optimum altitude. Shoulder tip pain due to the irritation of peritoneum underlying diaphragm from any surrounding pathology causes referred pain in the shoulder. This is because phrenic nerve carrying impulse from peritoneum and subclavicular nerves both arise from the segments of C3 and C4. This is an aspiration method. Wherever we put the syringe and we remove the blood, remove the fluid for the testing purposes. Wherever there is a presence of TB or there is a presence of any other situations, aspiration is done from the shoulder. Now the frozen shoulder, it is a very clinical and common cause in old age people where the synovial membrane around these two synovial membrane come close to each other and they do not let shoulder to move, so it look like frozen, it's not moving, so the name given is frozen shoulder. Third one is exclusion of a shoulder joint disease. It is said that whenever you have any shoulder joint disease, if you can do like this movement of a shoulder joint, deltoid, you can flex fully deltoid, it is said that you can exclude all the diseases related to the shoulder joint. Okay, so for today, thank you. This was all about the shoulder joint. We will meet in the next session.